Hi, my name is Veronica Ferris. I'm a breastfeeding educator. My pronouns are she, her. Today we're going to go over some of the benefits of breastfeeding. And there are many benefits of breastfeeding for both yourself as the one who is feeding your baby, and there are many benefits for your baby as well. We'll start with the benefits for your baby. One of the main benefits of breastfeeding is that it's going to provide all of the nourishment that your baby will need for the first 6 months of life. It can also continue to provide benefits that will help your baby to grow healthy and strong. One of the main benefits of breast milk is that it's tailor-made for your baby. It's much easier to digest than formula, which means your baby is less likely to experience things such as constipation or diarrhea, or even reflux or gastroenteritis. And this is because, like I said before, breast milk is tailor-made for your baby. It's going to change throughout the day. It's going to change as you're exposed to illnesses around you, or germs around you. Your body, as it's producing antibodies for you, it will produce those for your baby as well. And they are passed to your baby via breast milk. Because of this, your baby is less likely to have to deal with many illnesses. One of the big benefits of breastfeeding in terms of illnesses for breastfed babies is that preterm infants are at risk for something called necrotizing enterocolitis, or NEC. This is an illness that causes the intestines it can cause like a hole in the intestine because preterm babies haven't finished fully developing, which causes bacteria to leak through the hole. Breast milk protects them from this. It coats the lining of the intestines and prevents this from happening. In addition, because of those antibodies that your baby is receiving, they're less likely to have experienced things like colds or other respiratory illnesses such as pneumonia, RSV, or respiratory syncytial virus, and whooping cough. And these benefits don't just end while they're breastfeeding. Babies who were breastfed are less likely to have things such as asthma, eczema. There are fewer childhood cancers that they develop, such as leukemia or other lymphomas. Breast milk also lowers the risk of your child from developing type 1 and type 2 diabetes. They'll also get fewer cavities, and they're less likely to become obese later in childhood. The benefits don't stop there. You also receive many benefits from breastfeeding your baby. One of the main benefits is that life can be easier and healthier when you breastfeed. For starters, your baby's food is always with you. You don't have to worry about preparing bottles or ensuring that you have formula and the proper amounts to mix if you're using water. So you don't have to worry about carrying water for bottles and formula around. Wherever you go with your baby, their food is right there with them whenever they need it. Breastfeeding can also help support and strengthen your bond with your baby. As you're feeding, you're noticing cues, and it can increase your confidence in your ability to take care of your baby because you're providing them with the nutrients that they need to sustain life. One of the other benefits of breastfeeding is that it helps stimulate the uterus to contract after pregnancy. You'll still notice that you have your uterus will continue to contract after you've given birth. And this helps it return to normal size. So the fact that your breastfeeding triggers the contractions to occur means that it's going to return to size sooner than for someone who isn't breastfeeding, which means you have less postpartum bleeding. You're also going to be at risk for fewer urinary tract infections. You have a less risk of anemia, and it decreases your risk of postpartum depression. Breastfeeding produces hormones that naturally soothe us, such as oxytocin or prolactin, which reduce stress and promote positive feelings in the nursing mother. In addition to those benefits that I've mentioned, you are also less likely to have certain illnesses. Breastfeeding protects you from breast cancer and ovarian cancer. It lowers your risk. And the longer you breastfeed, the greater the decrease in risk for those types of cancers. It also lowers your risk of rheumatoid arthritis and lupus. And just like with your baby, breastfeeding lowers your risk of diabetes as well. It can also, for some women, help them to lose weight because your body expends so many calories in the production of breast milk. It is the perfect meal for you and your baby. Does anyone have any questions at this time?